By the way, you guys can all hear me. We don't need a microphone for this? Does that work for all you? Yeah, I think we'll be fine. Okay, there we go. Hi. Hi. My name is Scott Salen. I'm the CEO of a company called Cyrano.ai. I've presented here a couple times. Some of you guys might have seen me last year or the year before. I analyzed Bradley's speech live on stage, and then last year we analyzed the mayor of Chattanooga. That was fun. According to his staff, the report was spot on, and we absolutely proved how to sell him a house and talk him into stuff. So my background is as a clinician. I spent a little over 20 years in private practice, chemical dependency centers, and as the executive director of a mental health clinic. So that is my bend. Just quick show of hands, how many of us are more on the clinical side of this? And then how many of us are more on the tech side of the world? Fantastic. So I'm going to talk about a little bit of both. I get in trouble when I talk about this, kind of a lot, because I care about it and I don't mince words. I've decided, out of respect for Bradley and Project Voice, to mix things up a little bit to reduce the odds of getting in trouble. And so I'm going to call a lot of these slides opportunity slides. So most of the slides you're going to see could be framed as a first slide in a deck, and I don't know why that turned off. Oh, there we go. Are we good? No. Give it a second. There we go. Okay. So I'm going to start with the end and start working backwards with the problem and again with the solution. 84% of therapists in America say they have the longest waiting list of their careers. Also, that other 16% is at the beginning of their career, the end of their career, or they suck. Has anyone tried to find a therapist in the last couple years? Has anyone tried to refer out a therapist for a friend, neighbor, or family member? It's not easy, right? Also, about half of the therapists, this is all from the APA, about half the therapists say they are burned out, they are overworked, and they are failing their patients because of it. So when you think of the compounding effect of our mental health system in America, not because of COVID, I mean, that made things worse, to be sure, but even before COVID, these were the numbers we were looking at, that the therapists are in trouble. The people in charge of helping resolve our mental health need mental support immediately. So like I said, that compounding is serious. And here's why. Here's some numbers I hate. About 50,000 people in America killed themselves on purpose last year. That's not 50,000 stories, that's 50,000 communities. As you all know, the ripple effects of that are very real. Almost 200,000 were deaths of despair. Now, the first 50,000 of that is the same suicide, but that's also drug overdoses and things like that. You guys understand what deaths of despair means. That's a lot of people. Here's a way to put that into context. While I'm on stage giving this talk, 2 people in America are going to kill themselves. During the last talk it happened, and during the next talk it's going to happen again. 2 every talk. By the time I switch to the next slide, 2 people will have tried. These are the numbers we're talking about. And then you say there's a school shooting every week in America is your first thought when you see that number, but no, it's worse. Because summer vacation, Christmas vacation, and spring breaks means that's more like 1.3. 1.3 school shootings a week. My son's in first grade. He doesn't know what a lockdown drill is for, but I do, and all the other parents do. We know that a first grader is being taught where to hide. But my nephew's in college, and when he was 16, he said to me, I don't get what these people are doing. Because the guy who's going to shoot me and my friends is in the drill too. He's been trained on where we're going to go. We're rehearsing getting shot at every semester, and the kid who's going to shoot us is getting a rehearsal every time and knows how to use that to plan and coordinate because he's been thinking about it for a while. And then you say, 94% of kids who just graduated high school say they have struggles with their mental health. Why? Because we told them no help's coming. We told them they're going to get shot at. And then we called them snowflakes for caring. It's insanity to me. It's absolutely crazy. So let's compare this to other tragedies in America. Let's start with 9/11. 2,996 deaths on 9/11. Big tragedy. I don't make light of that at all. But we have statues, monuments, songs. We spent a couple $1 trillion and went to war for 20-something years because of 2,996 people, because we did not say 9/11 happened to a couple people in some buildings and some airplanes. We said it happened to all of us. We said this happened to America, and so we rallied around it. 2,996, almost 1,000 more high school students attempt suicide every day. 3,800 high schoolers, that's a 4-year window. Do some quick math. Every week in America, 10 times as many high school kids attempt suicide as there were fatalities on 9/11. If we filled the planes with junior high schoolers and crashed it into NYU, what would we have done differently? How would we remember that? Because that's happening now, and it's been happening for over 15 years. Now let's compare this to COVID. 4 people during COVID who were under 45 years old, suicide was twice as deadly. It was twice as deadly that you were going to kill yourself than COVID was going to get you. So my question is, where's my Dr. Fauci briefing every day on how to flatten that curve? Who's working as hard as Moderna and Pfizer work? We shut down the country and mailed everybody checks so that we would be safe. And this is worse every day for years and years. Don't worry, everything's getting worse, okay? Again, APA numbers, basically everything they measure is getting worse every year, and the rate at which it's getting worse is also increasing. So like I said, if you need a problem slide for your fundraising deck, here it is. This is why mental health is finally getting VC support. And in the inflation and the post-SVB and all that stuff, this is the area that they're still saying there's funding available for because it is the biggest problem. Like I said, I get in trouble when I talk about this. I went to the United Nations a couple years ago for the AI for Global Good conference, and there was a ton of wonderful, smart nerds and do-gooders, and I love them all. But I said something that got me in trouble, and I said, who cares how warm the ocean is if everyone's dying? I don't care what's happening to the rainforest if the most educated generation in the history of humanity is killing themselves on purpose and killing each other at an unprecedented rate. This is the problem slide. This is the problem. It's an existential crisis that we've been asleep at the wheel for. All right. Now let's get happy. We can help. So those slides that I just showed you are why I shut down my clinic. We were growing. We had Obamacare funding. We were looking good. We were hiring people. And I realized I was a garbage man. I realized by the time the people got to me, we were picking up trash. We were working with tons of at-risk teens. And so when I shut it down to build an AI system to help, people said to me, oh, you're building a thing that can diagnose. No, that's not what we do. For a few reasons. One, the diagnosis is an important but very small part of helping people. Many of you know this. There's 2 insurance codes when you see someone. One's called a diagnosis code, and one's called a procedure code. Diagnosis code is you broke your arm. Procedure code is we give you a cast. But I know, and many of you know, that in mental health, the diagnosis code and the procedure code are related, but not cause-effect, because I would see somebody with 10 people with the identical diagnosis, and I would treat them differently. And that could be cognitive behavioral therapy, that could be equine therapy if you want to ride a horse. It's weirdly effective. It could be occupational therapy, it could be all sorts of things. It could be acupuncture and beating drums and talking about things, whatever. There's different ways to help people. And that's what I wanted to pay attention to. I was like, okay, how do we help people? How do we help as many people as possible? And here's what I realized. Those slides, those past few slides, are end game things. Let's back up. Let's get upstream. I don't want to be a garbage man anymore. So I said, only a few people get to diagnose. And only in certain contexts do they get to diagnose. But everybody gets to talk. Everybody gets to listen. Everybody gets to support. So what if we help that? What if we get way upstream and try to reduce those numbers on the previous slides by helping people when the problems are small? And so that's what we built. At Cyrano, we built an AI system that powers those conversations. I love this quote. I've loved this quote for a long time. People don't care how much you know until they know how much you care. This is the problem with chatbots. They don't care about you and you know it. They're great. GPT's cool. It's a really fun thing, but you know it doesn't have empathy. You know it doesn't really care about you. That's okay. So what if we could build something so that we would make it easier for you to care for somebody? What if we make it easier for you to audience a person, to motivate a person, to understand what actually moves the needle for them? So you can speak to them in their language. You can hit with their priorities. We have 39 patent claims awarded on our system so far. We're measuring things that other companies aren't measuring, and we give actionable advice. I'll show you in the next few slides. Everything in italics from now on is output from our AI. It gives actionable advice to people. We can do this at the speed of transcription, and we push advice to the person, not based on just the scenario, sure, but more importantly, based on the psychographics of the individual. We look at language behavioralistically. In the same way that Amazon says people who shop for this buy that, in the same way that Netflix says people who like this enjoy that, we can say people who speak like this think like that. Makes sense. We just applied it and turned it into a so what. Let's make this about healthcare, and let's just work our way backwards from inpatient all the way back. Let's say we get a knee replacement. Okay, I get a knee replacement. Well, the surgeon did a great job, but we all know that my physical therapy, my rehab, and the effort I put in determines my patient outcome. We know that. That's easy to say. So how do we get the doctor to do better than bring in 4 pieces of paper stapled together and say, I did a great job, here you go talk to a PT and we'll talk to you in a couple weeks? What if in the same way that we imaged that knee so that the doctor could come up with a plan, we image their personality so the doctor can improve those patient outcomes right there. And to do so without changing the choreography. We can take the conversations that are already happening. We can take the intake from anywhere. We can use it off your Twitter feed. And we can say, this is the psychographic profile of this person. This is how we get them to follow through. We measure their commitment level in 32 categories that are proprietary to us using motivational interviewing, behavioral psychology, things like that. And we can say, this is where the person is in their commitment level. This is what we need to do to make sure they do the PT. Simple. Let's back up. Let's work with the whole treatment team, maybe intensive outpatient programs. I spent a lot of time in those. And the previous presenter was bringing up some wonderful points on this topic, or 2 presenters ago, about session notes. So I'd worked as an independent contractor. In addition to having the clinic, I worked as an independent contractor in 9 drug rehab centers at a time. And in those 9, I would do what's called process groups. It's group therapy sessions and then individual one-on-ones. I got pretty good at public speaking. And so my process groups, my group therapies and drug rehabs, on a high side, I would have 60 people in my group therapy. I'd have more people doing group therapy with me than there are in this room right now for an hour. And then I had to write session notes on every single one of them, including the guy who is still detoxing in the corner. I had to write session notes on the people who were silent. And then also for all the individual one-on-ones that I was doing, you have to do SOAP notes, right? Subjective, objective assessment plan, basic stuff. And I knew the clinical director was not going to look at it. I knew the case manager was not going to look at it. I knew nobody was going to look at it except for a CARF audit, maybe once every 18 months. And an insurance person would look at it, like the previous presenter was talking about the insurance company billing notes. So I knew clinically, this was a waste of my time. In terms of patient outcome, I was lighting my time on fire after work. I was not getting paid to do all this homework. So let me tell you how good my session notes were. I'm done telling you how good my session notes were. I hired my secretary to write them for me. That's not allowed. I shouldn't be saying that out loud. I'm recording it. I don't care. Fire me again. I quit already. It was really simple. I said, here are, and I just wrote 50 notes. And I said, rotate these for all group therapy. I'll do the others. And the clinical director would go, Scott, you can't do that. And I was like, stop me. Yeah, thank you. It's going to keep doing that. I'll keep trying to remember. But that means that my notes were useless for session prep. But so were everybody else's in all 9 of those rehab centers. We all knew we were all overworked. We all knew we were slammed, and we all knew it was homework. So none of us tried. And that creates a terrible, vicious cycle of wasted effort and wasted opportunity. Because I knew not to read anyone's session notes, and they knew not to read mine, and that exacerbates throughout an institution, but also throughout an industry. So what if we could make it useful? What if we could do session prep as a service? Because session prep is stressful. When you know you've got a client coming in who you haven't seen for a while, and you want to do your homework and get the running start, you've got to read everything you did. What if it was actionable? What if it just told you, here's what you need to do? Here's what you need to do in your next session. Our AI says, in your next session, try stuff like this. And it's just a sounding board. It's just an idea. It's inspiration. It doesn't tell you how to do your job. It gets right out of your way. It's not a checklist. It's, here's some stuff you might not have known. It's like Copilot. You know, everyone's talking about Copilot for GitHub, and Microsoft's talking about their Copilot. It's Copilot for talking to people. It's Copilot for connecting with people, rapport and empathy. Let's back up again. We're not an inpatient anymore. Now we're in a crisis hotline. Everyone who's ever done a crisis hotline has had this experience. You think, oh my God, this person needs help. And then your next thought is, oh my God, that's me. That's a scary moment. I don't know how many of you had that moment of, oh my God, that's me. Are we? Oh my gosh. I'm running long. Sorry. I told you I'd get in trouble. All right, we'll do this fast. Crisis hotline. We can help there. Speed of transcription. Give those people the information they need. Back up again. Coaches, counselors. Talk about large client loads. My mentor, who ended up being my clinical director, he had 200 clients in his caseload. He's working inner city LA. How do you remember what 200 clients need? Well, the system can do this for you. Session prep as a service. Peer support. This one I'm really, really proud of. We've partnered with the guys who created the Warrior Games and No Vet Left Behind. They've built a tool, we help power it, that helps soldiers talk to each other. Just reduce the friction in getting started. It says, hey, Tony, Dave's not doing well in his exercise routines according to the app. He's asked you to talk to him about it, as you guys all opted in. Here's how to get started. Say this, not that. We just make it easy to get the conversation going. Let's back up again. Just feeling connected. Some kid from a small town goes to a university, all of a sudden UCLA feels very big. What if it was an anonymous app to help talk to each other? But because it's anonymous, you don't have rapport yet. What if the AI could give you the rapport you need cold? So you walk in flat-footed, but the system says, here's what you need to know about the person. Not any personal information, no PII. This is all HIPAA compliant. Nothing the person says is ever shared. Only the subjective assessment of the algorithm is shared. The Wright brothers invented the plane crash. When we're building really cool tech, we're also building potential disasters. And that's why we have seatbelt laws and airbags and crash test ratings. And we have, the person has to tell us that the oxygen masks are going to fall down, even though we're not going to use them and everybody knows it's just a rule. And the reason we had that, hey, let's all pause for 6 months, was to start figuring out what the rules should be, what the regulations should be, how do we help them. And we can't have tech bros who are thinking about this as a land grab be in charge. BetterHelp got fined for putting their patient data on Facebook to create better ads. That's disgusting. Then the suicide hotlines data got put into call center support algorithms. This is not just mercenary, this is offensive. I'm very proud of the fact that my company's been working for 7 years on this. We've moved very, very slowly. We didn't start in healthcare. We intentionally started in high-ticket sales of homes and cars, because those are high-value conversations with clear outcomes that create better training data. And we were able to train our model. We built 70 million minutes of data in our own data lake before we went to healthcare. We did a pilot with 50 therapists for 9 months, got their feedback, and then built our tool. We spent time getting these patents so we can go enforce when there are bad actors. I'm really proud of the methodology our team and our investors supported to make that happen. Finally, I want to help you. We've built this to be an API because some of you guys already have locations where you're working, contracts, domain expertise, software, whatever. Our tool's an API. This is a feature that I want to put in any of your systems. I really, really mean that. I came here to partner with you guys. Last year I said I've got a pile of Legos that I want to add to your pile of Legos. That's it. I just want to add a couple features that are going to make it even easier for you guys to keep doing the good work you're doing. I'll share these slides with anybody who wants them. Also, real fast, Cyrano.ai/trial. If anybody wants to see how our software works, you can go in there and copy paste an email from somebody, and you'll get a little simple report. Just click on the button that says try first impressions, and you'll just get a quick first impression on the person. If you want to see a more robust thing, just come find me. I'm happy to show. I'm happy to share. I'm happy to partner with any of you. Thank you guys all for your time.
When we said strap in, we really meant it. Next up, we've got Waypoint Health and Grit.